Hello everyone. So in this video we will talk about progestogen only contraceptive. So firstly talking about oral, we have progestin only pill or also known as mini pill. Second one is parenteral formulation like depot medroxyprogesterone acetate, nithin NETEN and implants. And we have LNG IUS, that is levonorgestrel intrauterine system. We will mainly talk about these in this video. So talking about progestin only pill, POP or mini pill. Progestin only pill is devoid of any estrogen compound. It contains only a very low dose of progestin in any and one of the following form like levonorgestrel 75 microgram, norethistérone 350 microgram, desorgestrel 75 microgram, linestrenol 500 microgram or norgestrel 30 microgram. It has to be taken daily around the same time each day and from the first day of cycle with no pill-free interval. The mechanism of action is they work mainly by making cervical mucus thick and viscous. Thereby, they permit sperm penetration. Endometrium become atrophic, so blastocyst implantation is also hindered. This cervical effect is apparent by 20 days of starting POP, but as it is short-lived, daily prescription of POP is given. How to give mini pill? The first pill has to be taken on the first day of the cycle, and then continuously it has to be taken regularly and at the same time in the day. There must be no break between the pack. Delay in intake of more than 3 hours, that is greater than 27 hours late, the woman should have the missed pill immediately and the next one as scheduled. Extra precaution has to be taken for next 2 days. So what are the advantages of this progestogen only pill, that is mini pill? There is the side effect attributed to estrogen, as we have seen in the previous video in combined oral contraceptive, are totally eliminated. There is no adverse effect on lactation, and hence it can be suitably prescribed in lactating women. And as such, it is often called lactation pill. It is often called lactation pill, and it is easy to take. There is no on and off regime like COC. And this pill can be prescribed in patients having medical disorder like hypertension, fibroid, diabetes, epilepsy, smoking, and the history of thromboembolism, and also in HIV positive women. And it reduces the risk of pelvic inflammatory disease and endometrial carcinoma. So talking about the mechanism of action of mini pill. It works mainly by making cervical mucus thick and viscous. Thereby, it prevents the sperm penetration. The endometrium becomes atrophic, so blastocyst implantation is also hindered. The cervical effect is apparent by 2 days of starting progesterone only pill, but at it is short-lived, daily prescription of POP is given. In our 2% case, ovulation is also inhibited. In our and 50% women ovulate normally, so that ovulation is not so important for side mechanism of action. The cervical mucus, these are the main mechanism of action, how this work. So that was it. And about disadvantage, it is mainly due to the progesterone component. There may be acne, mastalgia, headache, as this is due to the progesterone, and it was also present in the common oral contraceptive, and it is due to the progestogen. There can be breakthrough bleeding. The breakthrough bleeding can be controlled by adding estrogen supplementation also. And all the side effects attributed to progesterone are like maybe evident in this by using this pill. And the simple cyst of ovary can be seen, but they do not require any surgery. And ectopic pregnancy can occur in 1 in 10 women. What are the contraindications of this pill, mini pill? Firstly, pregnancy, unexplained vaginal bleeding, recent breast carcinoma, arterial disease, thromboembolic disease, and women taking anti-seizure drug. Here, in injectable progestogen, we have the preparation commonly used are dipomedroxyprogesterone acetate, DMPA, and norethistérone ethanate, norethistérone ethanate. Both are administered intramuscularly in the deltoid or gluteus muscle within the 5 days of cycle. The injection should be deep and jet track technique should be used, and the site should not be massaged. The dipomedroxyprogesterone acid DMPA is used in the dose of 150 milligram every 3 months, 150 milligram in every 3 months, or 300 milligram in every 6 months, and Niten is used in the dose of 200 milligram in the given 2 monthly interval. Its mechanism of action is same, almost same than as we discussed earlier, but it has a additional, like it inhibits the ovulation by suppressing the mid-cycle LS peak. It causes cervical mucus thick due to progesterone and viscid, thereby preventing the sperm penetration, and this effect takes approximately 7 days. Additional contraceptive for first 7 days is required. It takes around 7 days to make this function, in contrast to progesterone only pill. Yeah, and it makes endometrium atrophic, preventing the blastocyst implantation. So talking about advantages, it eliminates the regular medication as imposed by oral pill. So, and it is it can be used very safely during lactation. It is probably increase the milk secretion without altering its composition. No estrogen related side effect occurs. The menstrual symptoms, that is menorrhagia, dysmenorrhea, are also reduced, and it is protective against endometrial cancer. It can be used as interim contraception before vasectomy becomes effective. The reduction in pelvic inflammatory disease, endometriosis, ectopic pregnancy, and ovarian cancer. The non-contraceptive benefit of DMPA are it reduces the risk of salpingitis, endometrial cancer, iron deficiency anemia, sickle cell problem, and endometriosis. So what are the disadvantages of DMPA? There is chance of irregular bleeding. A common oral contraceptive can be used for 3 months, and occasionally phase of amenorrhea, return of fertility after the discontinuation is usually delayed for several months, around 6 to 12 months. And but with Niten, the return of fertility is quicker. There is loss of bone mineral density, reversible with the long-term use of Depo-Provera, and it is suitable for adolescent and with perimenopausal women. And there can be other side effects like depression, weight gain, and headache. Contraindication are same like women with high risk factor for osteoporosis, breast cancer, and other are same as in progesterone only pill. So in summary, both DMPA and NET-EN are long-acting progesterones. The amenorrhea is common and thus helpful for women with history of heavy menstrual bleeding. It is a contraception of choice for women with sickle cell disease. Weight gain is common complaint. The injection of DMPA can be administered up to 4 months. The efficacy is not affected with concurrent use of enzyme-inducing drug. Now we will talk about implant. The next plan on is a progestin-only delivery system containing 3-keto-desorgestrel, that is etonorgestrel. It is a long-term, up to 3 years reversible contraception. It consists of single closed capsule and contains 68 milligram of etonorgestrel, and it releases the hormone about 60 microgram, gradually reduced to 3 microgram per day over 3 years. The implanon doesn't cause decrease in bone mineral density. The mechanism of action is that it inhibits the ovulation in 90% cases, 90% of the cycle in the first year. It has got a supplementary effect on the endometrium atrophy and cervical mucus. It makes cervical mucus thick, as previously we have seen, and also it has advantages same as DMPA. like it others other advantages like it is highly effective for long-term use and rapidly reversible. It is suited for women who have completed their family but do not desire permanent sterilization. It improvement of anemia, reduced seizure frequency with women with epilepsy, reduced frequency of pain crashes in women with sickle cell disease. The efficacy of Nexplanon is extremely high, and it is a safe and effective method, and it is reversible sterilization. The risk include the infection, nerve injury, migration or in-cord replacement. Drawback like frequent irregular menstrual bleeding, spotting and amenorrhea are common. It can be difficulty in removal occasionally, and contraindication are similar to progesterone only pill. Next is we have Norplan 2, that is also known as Jadel. In it there are two rods of 4 cm long with diameter 2.5 cm. 2.5 millimeter. This is not centimeter. This is millimeter. And it releases the 50 microgram of levonorgestrel per day. It is used for 3 years, and it is rods are easier to insert and remove. In summary, we can say that the implants have very little or no risk of venous thromboembolism, stroke or myocardial infarction. There is infrequent bleeding. It is and that was all. Thank you, and that was all about. That was all we discussed about progestogen only contraceptive. Now in next video we will talk about emergency contraception. Thank you.